We're going to be working through some examples of shoulder rehab using the build principle, where B stands for body position from the neurodevelopmental standpoint, working from ground positions to transitional into standing, and the U for upper extremity activities from an isometric hold into fundamental movement patterns, I for input from low-level passive to active assisted all the way up through the resisted, L for lower extremity, again, isolated motions or fundamental movement patterns. And then D for disassociation or integration, always working on core control and first disassociating movements of adjacent segments, and then integrating those segments into fundamental movement patterns of the upper extremity and lower extremity for normal function. So we always start with diaphragmatic breathing, good core stability, scapular packing, and now we have cervical disassociation. We continue with the core stability and the diaphragmatic breathing and the scapular retraction, but now we're disassociating into hip extension into a bridge. We can advance that for more neuromotor control of the trunk by giving her a ball underneath her calves and ankles, while still getting core contraction, relative extension of the shoulder with scapular packing. Similarly, we can work on lower trunk rotation, requiring some thoracic rotation. So this would be scapular packing, core stability with thoracic rotation in a hook lying position. And we can advance that by lifting your feet up off the ground for more core control, a little bit more challenging. We can advance the arms out to 90, requiring more scapular stability in a more elevated position, still working on core control. And then we can advance that into more of a diagonal 2 flexion pattern, bilateral upper extremity, requiring quite a bit of control. If we don't quite have all the mobility in the shoulder to get all the way flat, we can support the arm with pillows. So now we're working at an active assisted level for the glenohumeral joint, combining scapular packing along with core stability and breathing, and we're going back to cervical disassociation with this new exercise. Now we can go to hip extension, integrating core, breathing, scapular packing, and hip extension. Again, at an active assisted level, going up into 90-degree shoulder flexion, isometric hold, working on squat patterning of the lower extremities. Similarly, we can put the feet on the wall and just have her work on that last little bit of hip flexion in that position. We could even challenge the hip abductors more by putting a band around the knees. Here we have isometric shoulder flexion 90 with hip extension on the ball, requiring more neuromotor control. So now instead of unilateral, we're working bilateral active assisted shoulder flexion to 90 with scapular packing, with cervical disassociation, of course with core and breathing. And then we could advance that to scapular disassociation for a punch plus to the ceiling. We can do the same series of exercises that we just did from a reclined position, hitting a little bit higher elevation in glenohumeral joint, still working disassociation of the cervical scapular regions. We can even advance that to include hip extension. Similar elevation position for isometric hold as the last exercise, but now incorporating a dynamic bilateral lower extremity squat. Now we're advancing to a push motion or a reach motion, supine for active assisted with a pole. Again, advancing to more of an incline. And now going back supine and incorporating the hip extension motion. Now doing that from an elevated position, getting a little bit more work out of the glutes. Also taking the shoulder through a little bit different arc of motion. We can advance that to true squat patterning with a ball, working core, breathing, scapular packing, and active assisted push motion. Once again, similar but at a different angle for elevation and a little bit more work out of the lower extremities. This requires quite a bit of neuromotor control for the core, as you can see. This would be more for the advanced patient to work on active assisted shoulder with dynamic core and hip extension. Supine elevation with a pole can be done in all the examples above. This would be an example of using that with the feet on the wall with that little bit of lift into hip disassociation. Still working from the supine position, packed at 90 degrees, scapular packing and core, we're going to work cervical disassociation and then integration for left rotation of the cervical spine along with scapular protraction, and then integrating thoracic rotation along with it, keeping the arm vertical to ground. When we put it together, we can go up to the elbow, which is the first part of a Turkish get-up, focusing on neuromotor control of the glenohumeral joint to keep the arm vertical to the ground, and now advancing that up to the hand of the opposite side, requiring a much larger range of motion for the right shoulder to go through. This can be advanced all the way up to the bridge, up to the elbow, up to the hand, and up for the bridge. All the time working at an active assisted level for the shoulder, keeping the arm vertical to gravity. As we move into resistance, this particular example is working on isometric shoulder extension with scapular packing, core stability, diaphragmatic breathing, and then we start over again, once again, with the cervical disassociation. Scapular disassociation, and now hip extension into the bridge. All of the previous examples can be incorporated into this as well, such as the squat patterning, working on hip and lower extremity disassociation along with the core control, scapular packing, and resisted extension bilateral shoulders. Hip extension with the ball out in front requires a lot more neuromotor control of the trunk, and you can combine that with the squat patterning. Many of our patients may not be laying prone because they can't for one reason or another, but if you're able to, with a younger patient such as this, you can work on scapular packing with cervical disassociation into retraction, flexion and extension, and rotation, all the time working lower core stability in this prone position with the scapulas in a packed, retracted position. This could be advanced to work a little bit of a hyperextension and full retraction into the scapulas. Once your patient is able to, based on the procedure and or injury in the shoulder, to weight bear on the shoulders, you want to get them in a scapular pacted position on prone on elbows, and once again starting with cervical disassociation motions, and while holding the stability of scapular packing, you can combine disassociation of knee flexion. And if you think of the anatomy trains, we're working the entire superficial posterior train in this position. We can advance this when they're in the active range of motion stage to start working on shoulder elevation on one side while scapular packing on the other. We can advance that for a hip disassociation into hip extension, requiring more from the body. In the side lying position, as with all the other positions, we would start with cervical disassociation, scapular disassociation, and thoracic disassociation or rotation. And then we would start combining those to integrate cervical rotation, scapular retraction, and thoracic rotation all together. As we move more through active assisted elevation and to active elevation, we can start working the arm in a 90-degree position and pack the shoulder. Once again, focusing on what's happening at the cervical spine, what's happening at the scapula. And then integrating that together so we get cervical, scapular, and thoracic motion combined as one, working as a team. Starting in the modified quadruped position, we can work on things even as simple as your Codman exercises or dangles. We can advance that for scapular packing with cervical disassociation. That could be advanced to scapular disassociation for scapular protraction and retraction. And while continuing to work core stability, diaphragmatic breathing, we can now advance this to thoracic rotation with integrated cervical rotation, along with a pull motion. Once they're at an intensity where they can do true weight bearing, we can work on cervical disassociation and scapular disassociation in a quadruped position. We can also work on somewhat of an active assisted elevation with stretch for child's pose. Now that we've advanced past cervical disassociation and scapular disassociation in the quadruped position, we can work on some marching, requiring more weight bearing out of one upper extremity, and then we can start integrating a pull motion as well as cervical and thoracic rotation integrated into that motion. Even a more challenging motion, integrating the cervical and thoracic rotation, is horizontal abduction of the upper extremity. Still working quadruped position, we can work lower extremity functional pattern for hip disassociation while using core and scapular packing. Of course, as the patient advances, we can combine all of those. An advanced quadruped position can be toes and hands, requiring a lot more core control, use of the hips and legs. Scapular packing is still a must, and we can even start over at cervical disassociation in that position. And advance it as far as all the way up to unilateral hip extension and or unilateral hip extension and upper extremity elevation. In that position, we can progress to crawling, focusing on proper core control, cervical stability, scapular stability, neuromotor control. Now working into a true plank position, except modified, so less extensive with regard to the weight and pressure placed on the upper extremities. We can do that with the hands on a table or a chair. Still working through cervical scapular disassociation, marching of the hands. Now working into lower extremity disassociation of the hip, knee, ankle flexion. And then integrating cervical rotation, thoracic rotation, and a pull and or horizontal abduction motion. Similar to quadruped, we can drop back into a hip hinge position, taking the shoulders into elevation in a modified downward dog position. And you could advance that to integrate a modified lower extremity squat position. Moving into a dynamic push motion. This is a modified plank with hands on table. And we can advance that to include modifications to the lower extremity, making it a little bit more challenging. These would be advanced to a true plank. And of course, we'll start back over with all the same progression of disassociation and then working into integration for lower extremity, as well as upper extremity. Going from simple marching to an actual pull motion and advancing to integrate cervical and thoracic rotation with that pull motion. In the half kneeling position, once again, we start working on the basics of can I maintain core control and scapular packing while I disassociate the cervical region, working on scapular protraction and retraction, and then working into thoracic and cervical integration and or rotation. At an active assisted level, we can use a pole. Starting back at the basics, can I control that position with my arm? And then can I dynamically start working that position for scapular protraction and retraction, working into a true reaching motion for active assisted reach in a flexion position of about 90 degrees, incorporating cervical and thoracic rotation based on the patient's ability to perform the exercises well. This, of course, flows beautifully into active range of motion, working on a dynamic reach along with the rotations of cervical and thoracic spine. This can be changed in plane of motion, start to reach more vertical, a little bit more challenging on the shoulder. In addition to the fundamental reach pattern of the upper extremity, we have elevations, which could be isolated and uniplanar or work through triplanar, and of course can start integrating in cervical and thoracic motions. Here's working on the diagonal patterns of PNF, just for the shoulder, and then integrating cervical and thoracic rotation. Opposite diagonal pattern for a D2, flexion and extension. Bilateral upper extremity chop motions, starting small and then truly integrating not only thoracic, but even into the lumbar spine for flexion and extension, thoracic rotation, cervical rotation, elevation of the shoulder. Another great mobility drill in the half kneeling position is put hands on floor, work on cervical disassociation, and then you can advance that into cervical rotation and thoracic rotation, integrating an upper extremity pull motion. That can be advanced to work on a horizontal abduction elevation of the shoulder as well. Once we step up to a loaded stage or phase, we continue with the same progression that we've been working on for disassociations of cervical as well as the scapular components, which, as you can tell, can affect balance and neuromotor control of the core. We can work on very low level loading of the shoulder just by simply passing it from side to side, still working core control and scapular packing. Halos in the half kneeling position really emphasize core control, moving the weight around the head, not the head around the weight, and bilateral shoulder mobility and coordination. To progress the loading stage, we move to a packed position with the kettlebell and or dumbbell, working integration, and then taking the half kneel position with that same racked position up into a full lunge. As we move into isotonic resisted exercises for the shoulder, we know that a pull motion is always easier on the shoulder than a push, which is easier than a lift. So we start with a pull, focused on the shoulder, and then integrating, as with our other exercises. Then we can change the plane of motion so we pull from a vertical position, working on humeral head depression, scapular packing. When ready, we advance that to a resisted pushing motion, starting isolated and then integrated with cervical, thoracic, and scapular motions. And finally, a resisted push vertical, which of course can be advanced from a half kneeling position into a standing lunge. Fantastic myofascial stretch for the anterior upper chest is holding this with core control, glute squeeze, working scapular disassociation with the kettlebell behind the back. This can be advanced for dynamic control. It can also be advanced by incorporating an isometric knee flexion, really hammering the abdominals and the rectus femoris in this position while taking the shoulder through an extension motion. Moving on to standing, we start, like all the other body positions, with passive exercises for the shoulder. This is a deadlift, which allows us to get passive shoulder flexion, which we can work on cervical disassociation and scapular disassociation just like the other positions. Working at an active assisted level in standing, we can use a stick or ski pole. Again, isolating and then integrating cervical and thoracic rotation with scapular retraction and protraction. Working into elevation for bilateral upper extremities, working in a functional squat position, taking the shoulder through a functional position as well as the lower body. Advancing that to a true reach motion with the upper extremities at an active assisted level. As we work into active range of motion in the shoulder and standing, it's very straightforward, always working through reaching motions as well as long lever arm lifts through different planes of motions. We can always add those to fundamental and functional movement patterns of the lower extremity, such as a squat. Moving into resistance, we can start with isolated scapular retraction, bilateral and or unilateral, and then again adding in the functional lower extremity pattern of a squat, simulating functional activity. The deadlift body position that we trained earlier can now be loaded, and the squat pattern that we were training can be loaded in a packed position and or with a resisted vertical push, with a chair for support and guidance, advancing to free squat. Farmer's carries are great, working on scapular packing, along with core control, advancing to marching 90-90, and then lunging. The same series can be performed in a packed position at shoulder height with dumbbell and or kettlebell, going from marching to lunging. That can all be done in the overhead rack position as well, really focusing on full elevation, scapular stability, core stability, while working through a functioning lunge pattern. Needless to say, any of the exercises that we worked through in this series that were at a passive or active assisted level or active level can be reproduced from a resisted standpoint using different tools, always working on disassociation and then integration of the cervical, thoracic, lumbar, and hip through fundamental movement patterns and planes of motion of the upper and lower extremities.